Thank you very much for coming along to today's session, which forms part of our Mental Health Awareness Week. Huge thanks to ITV for allowing Dr. Paul Litchfield to come and talk to us today about lockdown living and beyond. Now I would like to get straight to Dr. Paul Litchfield, who is the chair of What Works Centre of Wellbeing and the independent medical advisor to ITV. And what I would like to do first is say over to you, Paul, to talk us through the session for today.
Thanks very much, Gilly. Good morning, everyone now. Right, so living in lockdown and beyond. We're at that phase now. We've been in lockdown for a couple of months. The doors are starting to open and the sun's shining here anyway. So we need to start thinking about the future and what that holds and about getting back to work. So a quick canter through that. The first thing to say is to remind ourselves that human beings are social animals. It's the way that we've evolved into probably the most successful species on the planet. And we've achieved that by collaborating. We achieve much more in society, in prospering the human race by collaboration than we do by operating solo. And what that means in an evolutionary sense is that we've evolved to need social interaction. And yes, that's seeing people, it's talking to people, but it's also the other senses, smelling, touching, they're all important. And if we don't get those stimuli, we become unwell. And if you think about the ways that we punish people or torture people, we put them in solitary confinement, we use sensory deprivation. Well, we don't, but evil people use sensory deprivation to torture people, which is the basis of white torture. So we know that those stimuli are desperately important to us psychologically and emotionally, and that without them, we don't do well. And so we can see that in what's happened over the last, just trying to move something here. Oh, that's fine. We can see that with what's happened over the last couple of months. So this is a piece of research published about 10 days ago now by Danny Fujiwara, Paul Dolan and colleagues. Danny and Paul are two of the best known researchers in wellbeing science. Danny's in the States these days, Paul is in London. And what their research showed was that when we compare the standard well-being measures, which are those 4 bars at the top, with this time last year, they've all got worse. And not only have they got worse, but they are the worst since we start measuring these things back in 2013. So well-being has taken a huge hit over the last couple of months. And the effect, just to put it in context, the effect on people is about twice the size that you'd normally expect from someone losing their job from redundancy. And all levels of well-being have gone down, but in particular, the thing that has been changed most is anxiety. And people's anxiety has gone up by about 40% over this lockdown period. And everybody across all the age ranges has suffered, but perhaps paradoxically, the old people, might say we old people, I suppose, but the old people who actually are most at risk from this virus are the ones who've suffered least. So if we look at the bottom set of bar charts, then the over 70s, yes, their well-being has dropped, but not by as much as other age groups. And the group which has been most affected is the under 25s. And when Danny and Paul did the analysis of the in-depth analysis of the data, they attributed about 2/3 of the reduction in well-being to social distancing measures. And that comes back to the point I was making at the outset. We're social animals, we need this stuff, and depriving us of us of it makes us ill. So that fits very well with the science of well-being generally. If we look at this slide and look initially on the right side at that rather nice tealy blue colour, the things that improve well-being for people, it's having someone to rely on, it's being in relationships, particularly partner relationships, but other relationships are important too. It's feeling that we're operating in an environment of trust, and it's being employed. Those are all the things that most drive high levels of well-being, and other things like physical activity, green space, good quality work, they all contribute to good well-being too. If we move to the other side and look at the orange and look at the things that reduce our well-being, it's being lonely, it's poor health, it's not being able to meet basic needs, and it's being unemployed. And if we think about the last couple of months in lockdown, we have taken away a lot of the stuff on the right-hand side, the blue stuff, the good stuff, and we've replaced it with a lot of stuff on the bad side, the orange stuff. So it's no great surprise that people are suffering. So what can we do about that? So one of the best evidence-based approaches to well-being is called 5 Ways to Wellbeing. It's something that was developed back in 2008 now by the New Economics Foundation. And what that research shows is that there are 5 key things that you can do, we can do as individuals, that will help to improve our well-being. And one of those is connect. In other words, talking to people, listening to people, feeling that we're connected with people. Now, in the current environment, it's quite hard to do that in a physical sense in the way that we used to doing, but we're a lot better off than we would have been if this had all happened 10 or 20 years ago, because we have this sort of electronic media that can help us a lot to keep in touch with people and to maintain those relationships. And it's been one of the features of the lockdown that people have probably made more contact with people they don't normally make contact with over this time than they normally would. So we need to do that. We need to connect with people. If we can't do it physically, although that is getting easier, let's use the electronic means at our disposal. Being active, taking exercise is important, but it's more than just taking exercise. It's getting on and doing things, and doing the things that you enjoy. And if those things aren't particularly going to get your heart rate up, it might be crocheting, it might be reading books, whatever it is, but it's things that you enjoy. Do them, keep your mind and your body active. Take notice of the things around you. So one of the things we're being encouraged to do at the moment during lockdown is to get out there, get into the environment in our local area, and to look at what's going on around us. So at the moment, when I go for my daily walk, the bluebells are still out in the woods, the birds are singing. Look at those things. We normally ignore them. With all the traffic noise, you sometimes can't hear them anyway. But take the opportunity that we've got at this time to take notice of what's going on around us, and particularly the things that make us feel better about life. Keep learning is an important way of improving well-being. This is an opportunity to do those things that we've been putting off for quite a while. Lots of online courses that we can do. Let's use the time to improve our knowledge, improve our skills. And then finally, there's giving. There's no doubt that people who give actually get more out of it than the people who are receiving. So let's use this opportunity. If we can't do what we would normally doing in terms of paid work, let's think about how we can do things that will contribute to society, contribute to those around us. And that might be our time. It might just be what we say to people and being there to listen to people. So those are the 5 ways to well-being, things that we can all do that will help us during these difficult times. And to put that into a practical sense, and particularly taking it on to the next level of improving our own mental health, there I get bombarded at the moment with stuff coming through telling me this app, that app, this website, is going to transform my mental health. And some of it's very good, and some of it, frankly, is snake oil. So find what works for you. I would direct you to the NHS site. Every Mind Matters is a resource that's been put together with a number of charities, in particular Mind, the mental health charity, and it's good, sound, sensible, evidence-based stuff. And I'm not going to go through the points on the slide in detail, but they all link back to those things that we know are good for our well-being. The one I will pull out, though, is not to put too much pressure on ourselves. I think often we have, particularly high achievers, have high expectations of themselves, and we can all beat ourselves up a bit too much. So let's just reflect at this time, give to others, be compassionate to others too, but also be compassionate to ourselves, and think about ourselves in a good way and not a bad way. And one of the useful things about the NHS site is that it will allow you to generate a mind plan. It's a very simple bit of software. You go on, you enter a few simple details. It's anonymized, so there's nobody sat in some data warehouse in Cheltenham or somewhere analyzing all the results. But you can go on there, you can construct a mind plan that works for you. And it's simple things that will help you to deal with your own stress, anxiety, improve your sleep, improve your mood. Now, as I said at the beginning, we're coming out of lockdown. I don't know how long that will take, but certainly within the TV industry, things are starting to open up and productions are getting back, albeit in a slightly different way. So I'd just like to talk for the remaining time about how we've approached that in putting together guidance that allows programs to be made safely. And the key to it is effective risk management. And the concept that we all have to get our heads around is that this isn't about eliminating risk. You can't, with most hazards, you can't eliminate the risk altogether. Certainly with COVID-19, we can't at the moment, and probably never will be able to eliminate the risk completely. So it's about reducing the risk and about reducing that risk as far as we reasonably can as employers and as individuals. And as we put that risk together, the key components of that are activity, in other words, what we're doing at work, and then vulnerability, and that's who is doing it at work. And when you add those two together, you get the risk, which is the chance of somebody coming to harm as a result of exposure to the virus that causes COVID-19. So in terms of the activity, it's essentially comes down to exposure to infected people, their coughs, their sneezes, their hands, if they've contaminated their hands with fluids from their nose or their mouth, or indeed surfaces that they've then touched. In vulnerability, anyone can catch the virus, but we know that it's more severe if people are older and have various medical conditions. If you're male, you're a third more likely to get seriously ill. And there's growing evidence that people from Black and minority ethnic communities do worse if they get sick with this virus. And that's what gives you the risk of harm. And that harm is, of course, a mild illness for most. We shouldn't forget that over 80% with COVID-19, 80% of people with COVID-19 experience a mild illness. They might not even realize that they have been ill, but a few people do become ill, and a few of those do die. So it's something we have to take seriously and something we can't ignore. So just say a wee bit about those two elements, activity and vulnerability. And there was a nice bit of research that came out probably about 3 weeks ago now from the US that graded the risk of catching COVID-19 based on US Department of Labor data. And they broke it down by the likelihood of contact with others, how close you have to get to other people, and then the likelihood of the people that you are coming in contact with having the disease, being infected. And if we look at the column on the left, as you look at the screen, that high risk column, then unsurprisingly, it's nearly all people in healthcare. It might surprise you a bit that at the top are dental hygienists and dentists and dental nurses are all pretty close to that very high level. But if you think about it, dentists, dental hygienists, dental nurses are working very, very close to people. They're working specifically in the mouth, and a lot of what they do generates an aerosol by using drills or whatever in the mouth. So those are the very high risk categories. The medium risk is people who either come in contact with a lot of people by virtue of their jobs, or are required to get quite close to other people by virtue of their jobs. And there we see people like hairdressers, bus drivers, people in the hospitality industry, and that's where actors sit, roughly mid-range. So a score of about 50 between 0 and 100 is where actors will sit. And that's largely because it's not about going to premieres and walking on the red carpet. It's more about having to get quite close to people, because most acting involves close interaction with other people. And then we move into the lower risk category, and that's where you find people in management. And in this industry, TV camera operators, reporters, correspondents, and broadcast technicians, all in that low risk category, not as low as some. And the key to protection then is social distancing and hygiene. Personal protective equipment outside of healthcare really isn't an important way of trying to control this risk. So then, who are the vulnerable people? In this country, we've classified people into two groups: those who are clinically vulnerable, if you like, those with an amber warning, and then those who are extremely vulnerable, those people, if you like, with a red warning. And in that first group, the amber group, people who are clinically vulnerable, it's anybody aged over 70, whether they're well or they've got underlying conditions. Simply by being older puts you at greater risk. For everybody, including those who are under 70, it's people who've got long-term illnesses, particularly illnesses of the lungs and the heart, other long-term illnesses like diabetes, or conditions like HIV/AIDS that give you a weakened immune system. People are seriously overweight, and by that I mean a BMI of over 40, so that really is very heavy. They also are at a higher risk, as appear to be women over the age of 28, past 28 weeks in their pregnancy. And those who are extremely vulnerable, the red group, if you like, that's people who've had organ transplants, people with cancers, particularly people being treated with a range of cancer treatments, people with the most severe lung conditions, things like cystic fibrosis or other lung conditions that are severe enough to require regular hospital admission, and then some people with rare conditions and pregnant women who have significant heart disease. So that's the vulnerable side of the equation. So what are we doing in the industry? So yesterday, an industry-wide approach to TV production was launched. In the end, all the companies pretty much within the industry have come together and signed up to the guidance, which is split into basic requirements and then more detailed actions that one can take to make the workplace safe. And those basic requirements are: think about those vulnerable groups, raise precautions for everybody at work, reduce the number of people involved in production, think about what you're asking people to do on camera, edit scripts where you can to reduce the requirement to come close together, and if so, to reduce the amount of time actors need to spend close together, to think about everybody's mental health and well-being, and then to make sure that we learn the lessons of practical implication when these things are being used and productions have gone back, which has now started. So just some examples of the specific controls, and they come down to physical controls, planning controls, and people controls. And I'll just quickly run through them to give you an idea If you just Google TV production guidance, you can pull it up. As I say, it was published yesterday. But in terms of travel, it's about minimising the amount of travel that we're requiring people, crew and cast, to do. If people have to travel, then try to schedule start times and end times for quieter times. And if we're using our own transport, to make sure that vehicles are fully cleaned and disinfected after use. On location, it's about trying to maintain social distancing as much as one can. All sorts of things are being put in place there. Some quite clever things like perspex screens for camera operators are one of the things that are being trialled. Using floor markings, making sure that if people are on standby, they spend that time in holding areas where they can maintain social distancing rather than just milling around. In terms of the activities on set or on location, getting people to self-mic and do their own makeup. I've already spoken about editing scripts, adapting scripts, and particularly on preparation and rigging days, staggering start times. So we have different teams coming at different times, not everybody arriving at the same time and working on the set at the same time. With the equipment, a lot of work's gone into that over the last month or so. It's around having dedicated equipment where we can, detailed and intense cleaning routines for that equipment, making sure there's plenty of supplies around, and making sure that we get rid of non-critical equipment offset or off location. In terms of working patterns, the concept that's being applied is to get people to stick in, to work within small teams and to keep those teams together but separate from other teams. And the idea is to reduce the amount of intermingling between groups of people. For rest areas, to make sure that those are adapted so that social distancing can be maintained, and to ensure that there's plenty of hand washing or sanitizer available. Specific things about first aid, the first aid guidance has changed as a result of COVID-19, and making sure that people involved in productions abide by that. A specific bit about masks and gloves, because they really aren't appropriate in this type of environment, but in general, masks, that's protection for individuals, and gloves are not a particularly good idea and probably don't contribute at all to minimizing the risk. And then finally, there's making sure that we consider the mental health of everybody involved in the production. So the industry is now getting back into work. Productions are starting. They've started in other countries. They're starting in the UK. What we know is from all the science that helping people get back into work will improve their health and well-being. In order to do that, an awful lot's going to have to change as we live with COVID-19, which is something we're going to have to for an extended period. And employers will play their part. They have a duty to play their part in providing safe places at work. I've already spoken about how in this industry, good practice is being shared so that everybody is doing pretty much the same thing, and that every organisation is learning from each other. The changes in a production are going to be significant. Now, a lot of us are not very good at managing change, but we have to manage that change. We have to adapt. Otherwise, we're going to compromise the safety of ourselves and other people. And if it's going to be successful, if we're going to get over the difficulties I described at the beginning that lockdown has caused, get people back into productive employment, then everybody is going to have to play their part in this. But if we do that, if we work together, then not only will we get shows up and running, but everyone involved in the industry will end up being healthier and happier. And that, Jilly, is me.
Thank you so much for your time today. Thanks, everyone.